In this video, I'm going to tell you all about getting the cast off and getting the removable splint. So I've been so distracted by everything with this arm that I completely forgot to charge the battery in my regular camera. So I'm back to using my little Sony, and hopefully this works out because I'm not waiting for that battery to, anyway, I got ready to film and didn't have a camera. All right, so here we go. I had the cast off 2 days ago, which was a Friday, and it was exactly 4 weeks and 1 day after surgery. All right, so I got some pictures of them removing the cast. I've never had a cast before, and yes, they do use a saw, but the woman who took the cast off, she demonstrated the saw and showed me that it doesn't cut your skin. She demonstrated on herself. But they still put a plastic piece into the, slip it into the cast so that they can ensure the patient that they're not going to cut their skin. And they cut it from the top and the bottom and pull it apart. Now here's what was so surprising. They said, don't flail your arm around, you know, after the cast comes off. It was really sore. My wrist was really sore. I think just from not using it. And then next I was going to go have the x-rays taken, but I said, you know what, I like to wash my arm and my hand. So they showed me where a sink was. Oddly, at this orthopedic place, they don't have sinks in the exam rooms. So went out, and while I was washing my arm, it just really hurt. It was just so tender, and just getting my arm under that little faucet, it was just really hard. So took the x-rays, came back, talked to the doctor, and he said, you know, based on the x-rays, it's looking really good. And this time I got to talk to him about the x-rays, because they did take them 2 x-rays on the day of surgery when I was completely out, and gave them to my sister-in-law. And I saw 2 little metal things in it. He said, yeah, they're just 2 little anchors. And I said, all right, if I'm ever going through one of those x-ray machines at the airport or whatever, and they say, is there any metal in your body? Do I say yes? And he goes, no, because it's so small, it won't really be detected. Okay. So he also liked the movement I had, which didn't feel like much movement, but he said, no, it's going really well. So next I walked over to occupational therapy, where they were going to make my custom splint. So I'm wearing it right now. I'm actually wearing it over my sweater, but very interesting process, especially since right now I work for the company that makes the sheets that this material comes from. And they showed me the sheet, and that was neat. And I actually got up out of my chair where we were working and went over where she was actually making this. So she measures me and measures me and measures me, and then heats this part up after cutting it. And then she came back and she molded it to my arm. Now I'm also wearing a sleeve under here, so I'm going to, whoops, she told me not to Velcro that way. Anyway, so there are Velcro pieces on top of it, but she told me to unvelcro it from this side. I'm going to take it off, and you can see my hand just fits in here, and the thumb piece goes over there, and she put a little cushion in here, and she made that part of the measurement process so that this wouldn't be too tight. Okay, and then I'm wearing a sleeve, which is optional, but it's really nice to have on top. And she gave me 3 of these total. So I wear them every day. I change it at night and then wash the one I wore during the day. And I'm going to pull this off. Now all the scabbing is gone. It was still there the day. Let's see if I could turn my arm this way. Hopefully you can see that, because with my little camera I can't tell. So here is a scar, and this one's still pink because that's where the biggest scab was. And then I had a little one right here. This is where they cut my wrist to, cut my forearm to snap a tendon that's still connected here, and then they pulled it through here and folded it and popped it into the cleaned up joint. Okay, so like I said, all of this was scabby when they took the cast off, but since then I've done some reading to find out how to best get these scars to heal. And so I'm using vitamin E oil, and I'll link below to the little tiny bottle I bought at Walgreens, which is really helpful. I already had that actually. Aqua 4 is good. And then okay, so I had the cast taken off on a Friday morning. My appointment was at 8:45. By the time I left, it was like after 11. So I was there for a good 2 hours and 20 minutes. So later, because they gave me exercises and OT and they showed me how to do them, I thought, well, I need to do them 4 times a day. So I took off this, I kept the sleeve on, and I was doing the exercises. Well, then part of it is also at the end of the exercises is massaging these spots. So the occupational therapist showed me when you move your skin moves really well, but when there's scarring going on under where you had stitches, it doesn't move as well. So I need to massage it for like 3 to 5 minutes. Now this one is super tender, so she told me to be gentle with it. So I wanted to do that following the exercises that I did Friday afternoon while I was still at work. So I take the sleeve off and my arm was just coated with icky dry skin. I mean, I've never seen anything like it on myself or on anybody else for that matter. And I work with some young people. So I said, oh, look at my arm. It looks like an old person's arm. And this one 25-year-old guy, he looked at my arm and he was like, whoa. And he turned back and he was covering his face. Look at it. So, you know, I washed it later and I've even used some light scrub since then. You know, it was covered for 2.5 weeks in a cast and a week and a half or 10 days before that in a bandage. So our skin wants to slough off. So anyway, all right, so it's really tender now. I will take off this if I'm just sitting and relaxing, but other than that, I leave the splint on all the time when I'm sleeping, when I go to work, when I'm doing my hair. I just don't want to make a mistake because I could easily do that. In fact, between getting the cast off and walking over to occupational therapy, I had my code and I had my binder and I had a folder they gave me and I had a smoothie cup, and the occupational therapist said, can I help you with it? Because she thought I was going to pick it all up. And she's like, your arm's not protected, stop it. So anyway, yeah, you don't want to do too much. So I want to show you, let's see, the other thing I want to tell you. Okay, so here's this Friday thing. So that was Friday. Friday evening, I had more pain than I've had the whole time, I think. I don't even think the day of surgery or the day after surgery or the 2 days after surgery, I had that much pain. I actually took 2 of the pain medications because I had plenty left that evening, thinking I'll just go to bed and sleep 10 hours, which I did. Yeah, it was that much pain. So I don't know why. And they said everybody's different. They said a lot of times people have this done, get to that day of getting the cast off, and they haven't had pain in a week or 2. They have no pain. They're done with pain. So, and as I've talked about in another video, I've had sensitivity here, which it's still really sensitive, which you can see it's really pink. Last night, I even put some antibiotic ointment on this and then put a thin Band-Aid on top and then the sleeve and then the splint. Just because the sooner it heals on the surface, the less it's going to hurt on the surface. But it's been hurting inside. So I'm trying to not do anything stupid. So yeah, I was kind of disappointed in the pain level. It's probably why I forgot to put the battery in for the camera. All right, so let me show you a few of the exercises that they have me doing right now. And I am going to go to occupational therapy twice a week. I feel really fortunate that I'm going to an orthopedic practice that has an occupational therapy group for the hand patients. They work hand to elbow, and then physical therapy works with everything else. So yeah, they're really, really talented over there. All right, well, the first thing I have to do with my arm supported on something, which I don't have anything to show you here, but imagine my arm is on a table. I have to like put my arm down and up, like 10 to 15 times slowly. and to just not do it to the point of pain. Okay, so that's an even gentle fist up, but just up and down. And then I'm not supposed to make my hand like this. I have to keep it, you know, it's just hard to do that. And then move it left and right, again on a table surface, slowly, and doing it like, again, 10 to 15 times. Okay, that's exercise number 2. Then the third one, with my hand up, I have to make a light fist and then fully straighten my fingers. Well, I've kind of been doing this the whole time because they told me when I had the bandage and the cast to wiggle my fingers. So I've been using my fingers a lot. So that's number 3. The fourth one is to just lightly touch my index finger and my middle finger to my thumb. Later I'll be doing all 4 fingers and even stretching my thumb over to here, but yeah, not now. So that is number 4. Let's see, we skipped a few other exercises on the list. And then the next one, I'm making small circles with my thumb, like 10 times one direction and 10 times the other direction. And then the last one is taking, I think I'm doing this right. I'm just using my other hand to help bend the tip of my thumb. And that's it. Okay, 10 times. And then comes the massaging these areas. So again, it's to lessen the effect of any scarring that's beneath the surface. So let me put my my lovely sleeve on again and splint. So here I am with this, the sock. Sock is nice. Although she cut it shorter, because of course they make them in one length for tall people with long arms, and it was cut, and so it's frayed on the edges, and I was wearing a black sweater and blue jeans, and I had little pieces of cotton all over me. All right, and then with this, I'm just gonna slip my thumb in there, and then well, apparently it's supposed to be pretty snug. I would usually do this on a surface, on a table, but then you wouldn't be able to see that. Okay. And it depends what you're wearing. It depends if you want to bring your sleeve down, you know, over what you're wearing or not. This time I can. So I'll get dressed first, and then just, well, before I was wearing the splint over the sweater, but it just depends on what you're wearing. I'm used to the cast having to fit under certain clothes, and I couldn't wear certain clothes. So that's it for now. So if I add more videos to this playlist, I'll be giving you more information about how I'm progressing with occupational therapy, how I'm progressing with the movement and with the pain level. And you know, the doctor said from the date of surgery till the time this is considered a complete process is 12 weeks. So by then I'll be at the end of December. That'll be exactly 12 weeks since the surgery day, which now that I think about it, I was like, oh yeah, it's winter. But he did tell me I can take this off when I'm driving if I need to put a glove on. So otherwise I'm driving with it, but yeah, because I get really cold fingertips. So that's it. Check out some of the other videos in this series. You can click the little eye in the upper right hand corner, just mouse over it, and then you'll see it and you can click, or click one of the images in the right side of your screen, or click the description box below, open it up, and you'll see other links to other videos. And thanks for watching. Bye.